The hospital environment is filled with infectious organisms that are carried by patients suffering from various conditions. Most infections spread through air, contact, food, and improper disposal of waste excreted by the infected patients. As a hospital assistant, you must use special equipment that serve as a protection from the spread of disease through air, contact, or food. Let us now look at some of the precautions that need to be followed by you. Wash hands before and after carrying out a patient care task. Wear gloves whenever there is a possibility of coming in contact with blood or other potentially infectious materials. Wear full body gowns whenever there is a possibility of blood splashing onto you. Wear face masks and eye protection whenever there is a possibility of blood splashing into the caretaker's face. Dispose all contaminated sharp objects in an appropriate puncture-proof container. Dispose all contaminated personal protective equipment in an appropriate container. Personal protective equipment. Some of the common protective equipment that can be used include gloves. Gloves are used to protect your hands from spread of infection. Gloves are made of vinyl or nitrile rubber, and these are to be used only once. Gloves should be worn any time there is a danger of touching infectious material or bodily fluids. Gloves should not be worn unnecessarily because prolonged and indiscriminate use may cause adverse reactions and skin sensitivity. Gowns are worn over the uniform when there is a danger that the medical professional may come into contact with excessive body fluids, or if the patient is in isolation, to prevent infection. They are usually made of a thin, waterproof fabric and are most often used only once. Full body gowns are not used very often outside of the hospital. Protection for the face comes in two forms: goggles worn over the eyes and masks worn over the nose and mouth. The eyes, mouth, and nose are the most common pathways for infectious agents to attack our body. This equipment protects you from many types of diseases. Use of face mask whenever blood or other body fluids may become airborne. Masks protect nose and mouth. It should fully cover nose and mouth and prevent fluid penetration. Goggles protect eyes, so it should fit snugly over and around the eyes. Face shields are used during patient care activities likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. Respirators are used to protect yourself from inhalation of infectious particles that are released into the air by infected patients. Using personal protective equipment. When you use the personal protective equipment, the equipment that is used should be worn in the following sequence. Place the mask over you, nose, mouth, and chin. Fit flexible nose piece over nose bridge. Secure on head with ties or elastic, and finally adjust to fit. While wearing a gown, ensure that you select the gown of the proper size and fit. Wear gloves in the following sequence. Select correct type and size. Insert hands into gloves. Extend gloves over isolation gown cuffs. In case you need to use a respirator or goggles, wear them after putting on the mask. While removing the personal protective equipment, you should follow the following sequence. Precautions to be taken while using protective equipment. Wash your hands immediately after taking off your gloves, and never walk around the hall with gloves that have touched a patient or a body fluid. Dispose of all single-use personal protective equipment immediately after use. Limit opportunities for touch contamination. Protect yourself, others, and the environment. Don't touch your face or adjust the equipment with contaminated gloves. Don't touch environmental surfaces except as necessary during patient care. You must wear a gown when you're doing something that may soil your clothes with body fluids. You should wear a plastic gown when the body secretion is wet. A plastic gown does not let wet body fluids go through the gown to your clothes or uniform. After the examination, take the gown off and dispose it carefully. Wash your hands immediately after taking the gown off. Once the personal equipment is removed, it should be immediately discarded and should not be used again. Safe use and removal of personal protective equipment will ensure that you are safe from exposure to the infections that can be life-threatening.